All right, so we've got a pretty hefty stack of articles here on Lean Six Sigma in healthcare.
We do.
And it seems like you're really trying to streamline things, huh? Trying to find that peak efficiency in healthcare.
Absolutely. And, it's interesting because it's not necessarily something that people immediately equate with healthcare.
Right, because when I think like streamline processes, I don't usually picture a hospital, I'm thinking more like well, I don't know, like a factory floor or something.
You're actually not that far off.
Really?
Yeah. The roots of Lean Six Sigma can be traced back to post-World War II Japan and the rise of the Toyota production system.
The Toyota production system. So we're talking about building cars.
Yeah.
How does it even translate to something as complex as healthcare?
So at its core, the Toyota production system, which laid the groundwork for lean thinking, is about identifying and minimizing waste in any process.
Okay.
And waste in this context is a lot broader than you might think.
Okay.
It's not just about like physical materials. It's also wasted time, wasted effort, even wasted potential.
Yeah.
And that's where the connection to healthcare, I think, really comes into play.
Right. Wasted time in a hospital, that's definitely something that, you want to eliminate if you can.
Yeah.
But how did this lean thinking then evolve into the Lean Six Sigma that we're talking about today?
Yeah. So that's where the Six Sigma part comes in. And it kind of emerged later, adding a layer of statistical rigor to the equation. So think of it this way. Lean helps you identify areas to improve, while Six Sigma provides the data-driven tools to measure those improvements, ensure they're significant, and make sure they're repeatable.
So it's not just about making changes, but making the right changes based on data and making those changes stick.
Exactly.
Okay.
And this combination of waste reduction and data-driven decision-making is what makes Lean Six Sigma so powerful, not just in manufacturing or healthcare, but in any field that strives for efficiency and effectiveness.
Okay, so we've got this interesting blend of manufacturing and statistical analysis. But what does this all mean for someone who's listening who works in healthcare today?
Yeah, that's a great question.
So we've established that Lean Six Sigma isn't just some abstract idea. It's got an actual toolkit for making things better. But how do you actually put this into practice, especially in a fast-paced world like healthcare?
Well, that's the beauty of Lean Six Sigma. It's the structured approach it offers. And you've probably come across this acronym in your research, DMAIC.
DMAIC.
Yeah.
I have to admit, at first glance, it did seem a bit like alphabet soup to me.
Yeah, it can seem that way, but it's actually not that intimidating once you break it down.
Okay.
So DMAIC stands for Define, Measure, Analyze, Improve, Control. Think of it as a roadmap guiding you through each stage of a Lean Six Sigma project.
Okay, a roadmap. I can work with that. So what's our first stop on this roadmap to Lean Six Sigma success?
So first stop, define.
Mm-hmm.
And you'd be surprised how often this absolutely crucial step is overlooked. Oh yeah, before you even start thinking about solutions, you need a crystal clear definition of the problem you're trying to solve.
Okay.
And we're not talking about vague notions here,
Yeah.
but a specific, quantifiable problem statement.
So instead of just saying we need to reduce patient wait times, it's more like we need to reduce the average wait time for patients being admitted from the ER to a hospital bed by 15%.
Exactly.
Yeah.
That level of specificity is key.
Yeah.
Because you need to know what you're aiming for before you can even begin to measure whether you're improving.
Right.
And that takes us to our next stop on the DMAIC roadmap, measure.
Which is where that whole data-driven aspect of Six Sigma really kicks in.
Absolutely.
Right.
In the measure phase, you're identifying the key metrics that will allow you to track progress towards your defined goal.
Oh, okay.
And this isn't just about collecting any data, it's about getting the right data, which might include things like wait times, patient satisfaction scores, readmission rates, or even something as simple as the number of steps it takes for a nurse to complete a task.
Wow, okay.
So tools like process mapping and statistical analysis come into play here.
So instead of just relying on gut feelings or anecdotal evidence, we're talking about hard numbers that paint a clear picture of what's really going on.
Precisely. And once you have that clear picture, you move on to the analyze phase.
Okay.
This is where you dig deep into the data to uncover the root causes of the problem you've identified.
Okay.
So why are those wait times so long? Where are the bottlenecks in the system? This is where tools like fishbone diagrams and Pareto charts can be incredibly helpful for visually representing that data and pinpointing those root causes.
So it's like detective work, but instead of following fingerprints, we're following the data. Okay, so we've defined the problem, measured the key metrics, analyzed the data to find those root causes. Where does our roadmap lead us next?
Well, next we move from analysis to action, the improve phase.
Oh.
This is where you brainstorm and implement solutions based on the insights you've gleaned from the previous phases.
Okay.
And again, it's not just about throwing solutions at the wall and seeing what sticks. Lean Six Sigma emphasizes testing and piloting solutions on a small scale before rolling them out more broadly.
So it's about taking a data-driven, iterative approach to improvement instead of just making sweeping changes and hoping for the best.
Exactly. You want to make sure that the changes you're implementing are actually having the desired effect and that you're not accidentally creating new problems in the process.
Right.
Yeah.
That makes sense. So this is really painting a clear picture for me of how DMAIC provides that structured framework for improvement. But we've got to be realistic here. Even with the best laid plans, things don't always go perfectly, especially in a complex environment like healthcare. So how do we make sure that those hard-won improvements actually last?
That, my friend, is where the final stage of our DMAIC roadmap comes in. Control.
Control. It does have that nice ring to it, especially after kind of wrapping your head around all those different stages.
Right.
But I imagine it doesn't mean that you just kick your feet up and relax at this point.
Not at all. This is where the real work begins. This is about putting mechanisms in place to make sure that those improvements we work so hard for actually stick around.
Right.
It's about sustainability. So that might involve standardizing those new procedures, implementing systems for ongoing monitoring and providing regular training to staff to make sure everyone's on the same page.
So it's about really weaving those improvements into the fabric of how things are done.
Hmm.
So it's not just a Band-Aid. It's about changing the system itself.
Exactly. You want to cultivate that culture of continuous improvement, where Lean Six Sigma is not just something you do, it's how you do everything.
I like it. Okay, so that makes sense in theory, but I'm looking at these case studies you gave me, and I'm really curious to see this in action. How does this actually play out in a real hospital, with all its moving parts?
Yeah, that's a great point, because real-world implementation, that's where the rubber meets the road.
Right.
Right? So that's why I pulled out this case study on Lakeview Healthcare. They actually implemented Lean Six Sigma across a bunch of different projects, and their experiences, I think, offer a lot of valuable insights.
Okay, like what?
So one project that really stood out to me was their bed flow value stream initiative.
Okay.
And they basically took aim at this notoriously tricky process of patient flow from the ER to inpatient beds.
Yeah, I can imagine that's a huge source of potential bottlenecks.
Absolutely.
Yeah.
Every minute of delay can impact patient care staff morale, not to mention the hospital's bottom line.
I bet. Time is money.
Yeah, big time. So Lakeview used a variety of Lean Six Sigma tools, including something called value stream mapping, to basically create this visual map of the entire patient journey from ER to inpatient bed. And it really helped them identify these hidden delays and inefficiencies that kind of creep in over time. And by streamlining communication systems, clarifying roles and responsibilities, they actually got some pretty impressive results.
Okay, spill the tea. I gotta hear this.
So they managed to reduce the average patient transfer time from the ER to an inpatient bed by 23%,
Wow.
which then led to a 10% decrease in overall ER wait times. But here's what I found really fascinating. They also saw a big drop in the number of patients who just gave up and left the ER without being seen. That number went from 4% down to 1.5%.
Wow. So we're not just talking about theoretical improvements on a whiteboard. This is actually making a difference in patients' lives.
Exactly, and it gets even better.
Okay, lay it on me.
The Lakeview case study also showed some really positive, unexpected benefits that really speak to the human side of Lean Six Sigma.
Oh. Okay, I'm intrigued. Unaccepted good, I hope.
Definitely. One of the most interesting findings was how it actually boosted staff morale.
Really?
Yeah.
I think any big change in a place like a hospital would just add to the stress.
Right. It seems counterintuitive.
Yeah.
But the data says otherwise. By giving staff clearer processes, better communication tools, a sense of ownership over their work, Lakeview actually reduced a lot of the chaos and uncertainty that leads to burnout.
That's amazing. So it's not just about making the system better, but it's making the experience better for the people working in it too.
Precisely. And happy, empowered employees, they tend to provide better patient care. So it's win-win. But of course, it wasn't all smooth sailing. Lakeview, like anyone implementing Lean Six Sigma, definitely faced their share of bumps in the road.
Like what were some of those hurdles they had to overcome?
Well, not surprisingly, resistance to change was a big one.
Right. You're messing with people's routines.
Yeah, people get set in their ways, especially in healthcare. There was pushback from some physicians who were worried that this whole data-driven approach might undermine their clinical judgment.
Yeah, That makes sense. It's that human element again. You can't
Yeah,
just impose new systems. You have to bring people along and address those concerns.
absolutely. And that's where having strong leadership and clear communication is so important. In fact, Lakeview's experience showed a direct connection between how much the leadership team actually bought into a project and whether it ultimately succeeded.
Yeah, so you need a champion, someone who really believes in Lean Six Sigma to rally everyone together, navigate those inevitable challenges, and keep that shared vision of better, more efficient patient care alive.
Exactly. And as healthcare continues to change with growing demands, new technologies, and more focus on value-based care, I think this need for adaptable, data-driven approaches like Lean Six Sigma is only going to become more and more important.
It makes you wonder, what role could Lean Six Sigma play in shaping healthcare systems of the future? Systems that really are better for both patients and providers. That's something to think about. That's all the time we have for today's deep dive, but a huge thank you to our expert for walking us through this fascinating topic.
My pleasure. It's been fun.
And to all of you listening out there, we hope this has given you a lot to think about as well. We'll see you next time for another deep dive.